Magandang hapon po. Hi! Hi everyone! It's a totally terrific Thursday. Totoo ba yun? And I'm happy to be here after a long day with Benji doing homeschooling. So ang topic po natin today is reinfection. And pwede ho bang magkaroon ng COVID ng dalawang beses? That's one of the questions po for Ask Dra Anna. Napakarami po talagang nagtatanong noon all the time sa mga sa mga online na mga tanungan ko. So, because of the new development, yun po ang pag-uusapan natin today. So, for those who are new to me, my name is Dra Anna York Bondoc. I am a pulmonary and critical care specialist po. I am from the University of the Philippines. I am also a psychologist by training. Ako po ang principal author ng psychology board exam. I'm also po a three-term congressman, the wife of Mayor Jason Sagom, and a mom po of a 7-year-old. So let's go straight to the topic para pag-usapan na po this very interesting development po, no? And our question po, our topic for today is now the formal start, ano po, ang tanong po is, pwede ho bang magkaroon ng COVID ng dalawang beses? Or in English po, it is called reinfection. Or pwede ho bang magkaroon ng COVID twice? Is it possible to get COVID again? So, marami ho talaga nagtatanong noon, and let's go, tuldukin po natin yung kaso and yung problema. Okay, the question that I always get is, Dear Doktora, totoo ho ba that you can get COVID twice? Ito po yung kwento ko. My husband is an OFW and got COVID abroad po in France. Ngayon po, pabalik na po siya ng Pilipinas. Well, ang sabi po niya is there's no need for him to wear a mask kasi nagka-COVID na po siya dati. So, he wants to have some time po dito sa Pilipinas. Na relax na lang daw. So, I was thinking na safe na po siya. But, hindi na raw po. And I keep hearing things about other patients po who got COVID twice. So, pakiklaro lang po, Doktora, dahil sobra pong nakakatakot po that you can get COVID twice. Help me, Doktora. So, yun po yung tanong. And people always ask that during the online sessions. And dati po, my answer to them is always, it's possible, pero wala pa hong kaso sa mundo. But now, there is a case. So, pag-uusapan po natin yon and what it means for us, ano po yung meaning nito clinically, ano po ba yung meaning, and ano po dapat natin gawin if you can get COVID twice, okay? So, let's go back to the basics, lalo na po since we talked to a molecular biologist last Monday. So the question that people often ask me, and siguro I never even discussed this, ano nga ba ang virus? Okay, what is a virus and how does it replicate? Kasi dito ho papasok yung yung tinatawag po nating different strains and different mutations. Okay, so let's start with the super basic. What's a virus? Okay, a virus po is a living organism na sobrang kaliit-liit po talaga. But what is very important about it po, it that it replicates or it propagates. Pumapasok po siya within the cell of an animal, a plant, or a person, and then it takes over the cell po. Pumapasok po yung genetic material. The virus is genetic material. It will enter the cell po, and then parang iti-take over niya yung cell, and then that cell becomes full of viruses, and then it just keeps on replicating po to cause what we call an infection. So the virus is really necessary. It needs to have a host. That host po would either be sa mga sa swine flu, that's pigs. Sa avian flu po, those are birds and chickens. Sa there are plant viruses. We know that there's a corn and there was a corn and a coconut virus. So they live within the cells of the plants and the animals. And sa mga tao. So what are the kinds of sakit po ng mga tao na virus? Okay? First of all, there's dengue. We all know dengue. 4 strains po yan. The flu is a virus. Some of that cause influenza virus po yon. Then there's other coronaviruses that are similar to COVID, which cause the ano po, which caused the common cold. And then nagkaroon po na SARS-1, similar to COVID. COVID is SARS-CoV. SARS-CoV po or COVID-19, ano po, which similar to the first SARS which happened po in 2003. Other viruses, hepatitis po is a virus. Polio po is a virus, chickenpox, mumps, and measles. Okay, so yun po yung mga viruses. So the SARS-CoV is an RNA virus. There are two kinds of viruses, RNA and DNA. So yung dalawang kinds of genetic material, yung SARS-CoV po is an RNA virus. And RNA viruses tend to mutate or change more rapidly than DNA viruses. Okay, so paano ho nag-mutate ang isang virus? Well, because of the rapid rate po ng replication niya. What's the meaning of rapid rate of replication in Tagalog? Or yung malinaw na pagpasok po ng virus sa cell, take over niya yung cell, and then magpro-produce po siya ng marami. It keeps on reproducing itself. Sa pagka-reproduce po niya, sa sobrang bilis po, there will be mistakes or changes po in the genetic code of the virus. Some of these mistakes are going to be hindi nyo po, and molecular biologists study this when they look at the viral, may po yan, listahan ng mga RNA and the genetic code actually. So, a lot of the viruses do mutate along the way. Some of the mutations po, we would never know unless we are molecular biologists. Kasi po, the mutations po are so small that they don't even matter. And then sometimes the mutations are so big na naiiba po, and this causes different strains of the virus. Okay, so what happened po sa Hong Kong? Okay, ang nangyari sa Hong Kong po, for the first time ever, there was a 33-year-old person po who was living in Hong Kong, and then nung March po, he tested positive po for COVID-19. He had symptoms, cough, sore throat, the usual po. And nag-test positive po siya for COVID-19. So he had a swab test, okay? Swab test for COVID-19. And then gumaling na po muna siya, and then he had po negative tests after that. So he was okay, and then he was traveling po. Siguro that's his job. He went to Spain and the United Kingdom. And then, nag-positive po siya during the screening in the airport. Pero wala naman po siyang naramdaman. He was actually okay. Which is 4.5 months after. So, what is very important, first of all, is wala pa ho talagang nakapublish na papers. So, yung details, intricate details, hindi natin alam. So, we're relying po on news reports. But what the news report said po was that the first nanoculture and the second, which is 4.5 months apart, are totally different strains. Magkaiba po sila dalawa. Okay? And so this is the first time that they were really able to culture po the first infection and the second infection. Okay? And so that is why they say that it is possible, though we have to look at the complete paper, that this person was infected twice by different strains po of COVID. Okay? So what usually happens po? Why would we say, how come we keep hearing bakit yung mga tao after 10 days positive pa rin ho yung swab? This has to do po with what we call remnants. Okay? So yung sa Hong Kong, first time pa ho lang ho yan sa mundo. Okay? So bakit ang dami-dami nating naririnig na months after positive pa rin ho yung swab? Okay, ang tinatawag po nito is they were positive the first time. And then, for example, nagka-symptoms, naging positive po, then nag-recover. And then after that po, 14 days later, swab, positive pa rin. And then, maybe, let's say, a certain swab became negative, pumasok na sa trabaho. Later on, for some reason po, na-swab uli, positive uli. Is that a case of reinfection? What I could usually say po, most of the cases po of persistently positive swabs are what we call po remnants. Ano po ang meaning ng remnants? The first one was the real virus, okay? And then after yung matagal, yung tinatawag po nating remnants, yun po yung mga natira na lang po after the infection. because the test is so sensitive, naka-pick up ho siya kahit pira-piraso lang ho ng virus. And that's how naging positive siya. But, two very important points po with regards to those tinatawag po nating remnants, okay? Number one po, hindi na po siya na-culture. In other words, hindi na siya buhay. In the lab, they were not able to grow it. Basta meron lang po. And then the second thing is, kung nakakahawa ba siya. Wala pa ho talagang kaso na nag-grow po nila twice, except for this. And then, the question is kung nakakahawa pa, we actually don't know. So I would like to tell you there's a case in South Korea po. Nagkaroon po na South Korean study a few months back na parang people were getting persistently, may balita nga ho that they were positive twice. Like long after the infection, repeatedly positive. So ang tanong is, are they complete? Are these reinfections? So the South Koreans po took 285 cases. Dun sa 285 cases na yun po, yes, pinag-aralan po nila, the swabs were positive. Pero the swabs, they could no longer po replicate, hindi ho nila mag-grow. So they consider those swabs to be dead particles or remnants. Okay? So ito pong sa Hong Kong is the first ever time na nangyari po yun. Okay? So, yun po yun. So can you get, so the question is, can you get COVID twice? Okay. It's possible po that viruses will regularly mutate. So possible ho na talagang nag-mutate po yung virus and he got a second strain. Okay? It's really possible po. But most of the time po talaga, most of the people, pag nagkaroon po ng COVID, they develop antibodies. Yung antibodies po yun ang panlaban ng antigens or which are proteins on the coat po of the COVID or the virus. So, nag-aaway po yung antigen and antibody plus the virus. And usually po, especially if you get better, yung katawan nyo po, nalabanan po yung infection. Okay? So, because na-expose po yung dugo nyo to the antigen, magkakaroon po kayo ng antibody, which are the fighter cells. So, these antibodies, yun po yung nagra-rise after the infection. In some people po, the antibodies continue to be high. In some people po, bumababa. But not to worry kasi as MB Joshua explained to us, meron naman pong memory cells ang katawan, the B cells and the T cells, na kahit ho wala na kayong antibody, nalalabanan pa rin ho ng B cells and T cells yung susunod pong infection. So, I hope you got it, but kung nahirapan po kayo, I'm willing to answer questions, okay? So, ito po yung summary ko of what happened. Number one po, prior to this talk, prior to this Hong Kong event po, nobody has ever been able to grow COVID twice in one person in the lab. Okay? Twice like far apart. Okay? The Hong Kong incident is the first time in the world and we are very interested to find out po kung talagang mangyayari po ba ito repeatedly or this is a one-time event. Okay? Number two po, most of the cases that we get that are repeatedly nasal swab positive are not really reinfections, but merely remnants po. There are also cases, and this could happen po, no, that maybe the COVID never really left the body of the person and lumabas uli. That can happen po. And I'll expound on that later if the answer is a question. Otherwise, I will explain that later. And so number four, the most important. Okay? Ano yung implications nito? This has implications for the vaccine. Kasi po kung palit ng palit po yung virus, mahirap pong maghanap ng kalaban noon or vaccine. Kasi po palit ng palit. But it looks like that the COVID has been relatively stable until this one major event po. And we don't even know how different the two strains were. Okay? So, it will have implications for the vaccine. Pero from all studies po, this is the first time. So, mukhang mabagal. And then, number two, implications clinically. Anong meaning nun? Okay, for this lady na nagtanong ng anong meaning nun? At marami rin hong nagtatanong sa akin, returning from abroad na nagka-COVID. Or even here, dito. Since nagka-COVID na daw sila, pwede na ba silang lumabas without a mask? I usually told these people, no, you have to wear a mask. Kasi even if never pang na-culture yung COVID na second time, ayaw nyo naman sigurong maging first person. Well, nangyari na nga ho yun sa Hong Kong. So, clinical implication po nito, whether nagka-COVID pa kayo ever, kung hindi pa ho kayo nagka-COVID, wear a mask. Okay? Kung nagka-COVID na ho kayo in the past, o ngayon, wear a mask pa rin. Kasi pwede pa rin ho magkaroon ng part 2. Nagkaroon na rin ho sa Hong Kong. So, what are the implications of this study? Hihintayin pa po natin. There will be more studies to come out. Pero ang implication po nito for the vaccine, pag-uusapan pa rin po yan. But the implications po clinically, anong dapat natin gawin bilang pasyente at bilang doktor, it's very simple. Mag-ingat pa rin. Because it's now possible to get COVID twice. Okay? So, I hope you got that. Kung hindi nyo po nakuha, because it's quite a technical discussion, wag po kayong mahiyang magtanong. Okay, and I'm willing to answer that. So, sige, Miss Rains, did you get it? Okay.
Yes, ako, doktora, na-gets ko.
Siyempre, you're a
Kasi,
nurse, ano? Oo.
yeah, yes. Plus, I had
sige, let's answer questions and then, sagutin po natin.
from Israel.
Pakiread lang yung name niya, hindi ko
From
mabase.
Israel Calyanta.
Misael?
Israel po. Israel.
Israel, okay. May reinfection cases po ba sa Pinas? Kung ba si Senator, nabanggit nyo na rin, kung Senator Zubiri case po, was claiming to be infected again at pinost pa ho yung rapid test result niya. But the problem was IgG yung positive. So, parang mishandled na po yung rapid tests dahil kasi non-health workers ang gumagamit. Okay. Two things that you brought up, Israel, and which I'd like to explain, okay? Wag na natin gamitin yung case ni Senator Zubiri. Senator Zubiri is actually a good friend. But anyway, ganito. Ang necessitating po, first of all, we cannot use rapid tests, okay? We cannot use rapid tests to diagnose whether you have COVID now. Okay? So if you iba po kasi talaga eh. Ang pinag-uusapan nito, the 2 positive tests have to be nasal swabs or PCR. What does the PCR test? It tests the virus. Ngayon, the antibody, completely different test po yan. Hindi po siya pwede to let us know whether you have been reinfected. Hindi po siya pwede. Okay? Kasi po, antibody po yon. Ang meaning po ng it's basically, we are talking about apples and oranges. So yung, eto po to say that there has been no reinfection case yet proven sa Pilipinas. What is the meaning of proven? Yung nagkaroon dito na may malaking gap at parehong lumago sa laboratorio. In other words, nabuhay nila. In other words, it was alive. Parang hindi siya dead particles. And so they have to be both nasal swab results and they have to be both PCR or nasal swab results and they both have to grow in the lab. So yung tinatawag po nating remnants, these were nakuha po sa PCR swabbing but they never grew in the lab. So ang tawag po doon, yung mga natira-tira na lang po na inaway po ng antibody. Now, if you are antibody positive, it is not related po to whether you have a reinfection. Okay? If you are antibody positive many months or weeks after your first infection, that means po, nagkaroon kayo ng COVID in the past. In the past. Not the time that you were tested. So an antibody means a past infection, not a present infection. Okay? So has there been a reinfection in the Philippines? Wala pa pong proven. Okay? So yun po. Other cases kung bakit po nagtatagal yung PCR. Number 1 case po, nagkamali yung laboratorio. It can happen, okay? Number 2 case, remnants po yung second. Number 3 case na pwede po is that your infection is continuing and it can happen po in rare cases. Extremely rare. And you can ask me, That's why yung time-based strategy, kung serious po yung COVID nyo, you have to be re-evaluated kasi meron pong lingering effects ang COVID. Okay? But again, after 14 days, 99.9%, most of the people are no longer talaga pong infective. One of the good questions dito sa reinfection sa Hong Kong na to is, was the person infected the second time? Hindi natin alam. So that remains to be seen. Kasi, it's also very important to know kung na-reinfect ka, kung nabuhay nga yung virus sa katawan mo the second time, and number two, kung nakakahawa ka pa rin. But again, I wouldn't take any chances. So wear a mask. Okay?
Okay, Doctor, we have
So
another.
please keep asking kasi po medyo mahirap po yung topic.
Okay po. Doctor, we have another question from
Sige.
Yami Tame.
From yan. Doktora, symptoms din po ba ng mataas na temperature pero di naman po umaabot ng 37.6? But hot flashes po. Ma'am, ang temperature, the official fever temperature po talaga is 38.5. Okay? Yung mga 37.6 na yan, mga ano lang ho yan eh. Those are what we call po variations in temperature. Sometimes po in 37.7 ganon, that means paakyat pa lang siya. But really, the official definition of a fever po, lalo na sa mga doktor, is 38.5. So yung mga low-grade temps, posible naman ho. Like kung hindi ho nawawala, low-grade temperatures. Actually, if you have 1 month of low-grade temperatures, nasagot po niyan TB. Okay?
Okay, next question po, Doktora, from Mr. Ray Burgis Vergara.
Good afternoon po, Doktora. Hi, sir. Itatang Boy Vergara, leader po sa Kansinala. Palagi pong manalbeke kayo. Thanks, sir. Thanks for always watching. Marami po akong nalalaman. Pwede pong magka-COVID. Yes, pwede po. The question is, can you get COVID twice? Well, there is only one case in the entire world. So it remains, marami pa rin ho tayong dapat pag-aralan. This could be a one-off or it could be a continuing po. Pero the fact na isa pa lang ho, it shows you something na it might be a one-off. O syempre ho, kung naging 100 na siya next week, ibang issue na ho yun. From Miss Marilyn, Doktora, the same virus din ba yon once reinfected or new virus po naman? Is it dangerous po pag reinfected? Ma'am, sa pag-aaral po nila ng genetic code, it is the same virus but there are variations. Okay, there are variations. So is it more dangerous? Ma'am, right now we don't know. Mukha naman from the case report that the Hong Kong guy was okay. Wala naman hong sinabi na na-hospital or na grabe. In fact, he was just, the first time he had symptoms, the second time po, it was just because he was passing through the airport. Wala naman nung nararamdaman yung tao. So, I guess, in this case, we would say that it would not be more serious kasi po, the person did not feel anything. So, I read po somewhere that when viruses mutate, they tend to down mutate. But again, hindi po natin alam. Okay, ang meaning po ng down mutate, less serious. But again, di po natin alam. Okay? So, bottom line is, there's a lot of things pa rin po na dapat malaman po natin. But again, clinically, sa akin po kasi, I'm a clinician eh. What's the meaning of clinician? Okay lang mo mabuting things sa laboratorio. But in the end, anong sasabihin mo sa pasyente? Konti lang ho, 3 words, wear a mask. Hindi ako interesado kung wala ka pang COVID o kung na-COVID ka na. Okay, wag mo nang ikwento sa akin yung na-COVID ka dati. Kasi marami yung piloso po na na-COVID na ako, I don't wanna wear a mask. Well, with this Hong Kong po, and I understand po, it's really quite difficult to wear a mask. Meron pa kong face shield, meron talagang hindi na ho nakakahinga, no? And unfortunately po, medyo kuminsan nagkalakas loob po tayo that, well, most of the time, like for example, chickenpox once, measles once, mumps once. And we presume na ganun din po ang COVID. But again, this is a new virus. So marami pa po tayong hindi nalalaman. And for those who got COVID before, even if you have high antibody titers or you still need to wear a mask. So Rains, ang dami nagtatanong dito, what are the implications of this? Well, sa implications nitong strain to different strains, for the scientists, marami silang dapat pag-aralan at sagutin. Pero for the basic doctors and for you and your family, madali lang po yun. Wear a mask. Continue to wear a mask. Yun lang.
Agree ako, Doktora. I could
Yeah,
never
there's a lot of implications to for scientists, yung gumagawa ng vaccine, bubuting tingin talaga nila to, for epidemiologists, etc. But for you, me, and our patients, wear a mask.
and
Okay?
social distancing talaga.
Yes, social distancing, kasama na yun. Okay?
Ako lang, Doktora, may dagdag ko lang ha. Pag alam nyo na nagkaroon ng kunwari, you have a known person na nagka-COVID and gumaling, social distancing pa din. Kasi you'll never know kung sino sa inyong dalawang may next COVID. Diba? E di hinawaan
Yes,
mo pa.
for both
Yes,
parties.
for
Yes.
both of you. Diba? So, until wala talaga to, let's practice what we are practicing right now. Yun lang.
Oo. Marami kasing nag-panic, Rains, eh. Sabi, Doktora, oh my God, reinfection, paano na ba to? Ganyan, 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 ganyan. Sabi ko, bakit kayo natatakot? If you're always wearing a mask, first infection or reinfection, you're okay. Siyempre, we don't want reinfections kasi talagang it's really sad that you could be reinfected. But again, if you're wearing a mask, then at least you are doing the right thing. The rest of the details will be worked out by the scientists po, those who are studying talaga, virologists, yung mga gumagawa po ng bakuna. Kasi kung sige, the question na rin. Sige, before I start, tapusin muna natin yung mga questions. Sige. From Jasmine, Doktora, how about po yung rapid antigen test? It is being done by nasal din po. Would it be reliable? Ma'am, we had a huge talk with a molecular biologist last Monday. Nakapost po siya sa babae. And I am not a testing expert, but I did hear the talk of a testing expert last Monday. And ang sabi po niya talaga, the rapid antigen testing is not yet po verified by the DOH. So we have to wait for that. Sabi niya po, and this struck me, Reina, sabi po ni molecular biologist Joshua, if we perfect the antigen testing, then that could be the screening test. Kasi even if you turn out to be antigen positive, antigen not antibody, antigen positive, most people would require po, you still need to confirm po with a PCR. But that could be, and it could be a good screening daw siya, sabi niya, but it's not yet perfected po.
It's
Even
really
in the States, it's not yet perfected. There have been cases po na iba-iba po yung naging ng antigen testing. Okay, so it's not yet perfect. So yun po.
Okay. Next question po. From Mr. Francis Alan Maniego.
Well, is there a test that could determine if nagka-COVID ka na po at gumaling ka na? Why would you want to know that? I don't know. I mean, good question, Reina. Why would you want to know that? Will it help you? May iba ba yung behavior mo?
Ako, pag alam mong nagka-COVID na and gumaling, acceptance na lang. And again,
bakit mo sabihin yun? Ang tanong ko. What's the point? I don't know. Please, i-share mo nyo sa akin para I can,
Yeah, me din, I don't get it eh. Pero for me,
hindi. Maraming ganyan actually. Maraming ganyan na parang feeling nila, nagkasakit sila nung then baka naman may COVID na sila, ganon. And they just want to know, okay? Kaya lang, the test for that is an antibody test.
Yes.
And more than that, so most of the antibody tests are not really reliable. Pati yung rapid, even if you want to know the past and you use the rapid test, hindi pa rin siya very reliable. There are antibody tests called the ECLIA and the ELISA. But again, they have they're better than the rapid. Pero I just posted an article po that antibody testing is really not very helpful. It is not. I posted an article in New York Times. Antibody testing should really be only used po in a research setting. Like gusto nyo hong malaman kung ilan po yung mga tao sa buong Pilipinas na nagkaroon na ng COVID. Yung mga ganun po. Okay? Or for special cases po for children na napaparelisado kasi they use or if you want to donate plasma. Pero for curiosity's sake, ma'am, I would not suggest that. Sir, I would not suggest that because first of all, the test is not that reliable, and number two, because of this new issue po, kaya nagka-COVID pa ho kayo dati o hindi, kailangan pa rin ho kayo mag-mask. So ako, I would really like to test lang if it is going to make a difference. Ba't ako magte-test kung wala naman akong babaguhin sa gagawin ko? So ang ano ko po bilang doktor, I would not just, for example, somebody just comes in and says, "Ay doktora, I just want to know if I had COVID." My question is, for what? What information will it give you that will change the way you act or move? Or kung curiosity lang ho, parang hindi. Ayoko pa rin eh. Unless talagang, what curiosity? No, kasi ang may maiiba ba na gagawin ko bilang doktor sa taong yun? Parang ang feeling ko hindi po kasi I would still tell that person to wear a mask eh. I would still tell that person po na mag-ingat. Kung sakali pong lalagnatin po yun at manghihina, I would still suspect COVID pa rin eh. So, yung sagot ko dun sa tanong na yon is, if somebody came to me and told me, Doktora, I just want to know, and actually, ako rin, I just want to know if I had COVID before. Baka kasi parang marami ko kasing feeling nila, inubos sila noon, ganun, during hindi na test. Pero ang advice ko sa inyo, wag na po, kasi wala naman hong maiiba sa buhay nyo eh. And with this new COVID part 2, mask pa rin eh. So yun, as a doctor, I wouldn't advise it. I would only advise it if we're gonna do something different or if you want to donate your blood plasma to another person at magkukusan loob po kayo magdo-donation. And you want to know if you have antibodies because your pamangkin is deathly ill, okay yun sa akin. But for curiosity, baka what if it turns out to be really that you had COVID before? Baka yung tamarin ka to wear a mask? Ganoon? So, sa akin po, I would discourage you from kasi sa amin pong bilang doktor, the question is really, what will you do with that knowledge? And if you read the New York Times article po, it says that the tests, tinawag pa nga Reina, sorry pero sinabi talaga sa New York Times article, if any lab tells you na magpa-antibody testing kayo, these people are mga, what we call, they said snake oil salesmen, or in Tagalog, ang meaning nun, manggagancho. Hindi ako yun New York Times yun. You read the article.
Agree.
Manggagancho. Okay? If someone tells you, alamin natin kung may COVID ka or hindi. And that's also quite dangerous. What if na positive yun? Alam mo naman sa Pilipinas, yung mga tao, nagpapanik dun sa barangay nyo. So, eto lang you should not be tested unless there is a good reason. Kasi lalo na with the antibody test. Kasi what if nag-positive? Yung mga tao kasi they don't think na, magpapanik na talaga. And again, if you become positive sa antibody test, that does not in any way mean that you have COVID or that you are nakakahawa. It just means that you got positive from a bad test.
Yeah.
So, sorry, ang haba na sinagot ko, Grabe, sorry talaga.
Pero hindi, tama naman din, Doktora, na para saan mo gustong malaman kung nagka-COVID na yung tao, is it gonna change something on your behavior or
change something in your life?
Yes. Or
unless you tell me, Doktora, I want to donate my blood plasma to other persons. That's why I want to know if I have COVID. Then magandang sagot po yun.
Yes.
Because you want to be helpful. But other than that, wala na ho talagang reason for us to really know.
No, yes.
Kasi it will not change our behavior for the better. It might even change our behavior for the worse.
Yes. Okay,
akin,
so,
oo.
Sige,
Tsaka
Doc.
again, most of the antibody tests going around now are not reliable. So, yun lang.
Yeah, and ako lang, idagdag ko lang, medyo minention na din natin to before sa mga previous na videos natin, live streams natin. Guys, yung mga rapid tests, don't do it on your own. Don't do it on your own.
Or even do it with a doctor. It's not a good test.
Napakadelikado nung magpiprick kayo ng blood and then ilalagay nyo dun sa parang pregnancy test. Don't you know that it's really, really dangerous to prick yung blood out of your skin? Very dangerous yun. Mamaya, iba pa ang infection na mahawa kayo. Tama ba ako, Doc? You'll never know what the person has.
More than the test itself, it's what are you gonna do with the results? What if it's positive? Baka mag-hysterical ka doon. Okay, so please, these kinds of tests should not actually be sold to persons. They should be done by doctors. And I just posted, people should not be doing antibody testing unless they are a lab or conducting po an epidemiologic study. Sa mga LGU, actually, hindi dapat po. So I'm sorry for the kilometric answer, but thank you for asking kasi po, napaisip po talaga ako. It really made me think a lot. And I'm sorry talaga, ang dami kong sinagot sa kaikli-ikling tanong. But the short answer to that, yes, an antibody test can tell us that a person had COVID in the past. Okay? But again, we have to be careful what is the quality po of the antibody test that we're going to use. And number 3 po, even if you have a positive antibody test and you are sure that it's a good test and that you feel that you really had COVID in the past, that's okay. But number 4, still wear a mask. Yun lang. Ang daming sinabi, my God, let's go on. I'm sorry talaga.
Pero maganda yung question niya, Doktora. Maganda.
Maganda. It's a beautiful question and very thought-provoking.
At saka valid eh.
Aside from answering the question, pinuntahan natin yung motibo ng taong pupunta sa'yo. Ano yung bakit niya gagawin yun? Yung magandang tanong yun.
Okay,
Ang
next
question ko, it really parang nabulabog yung utak ko. It's a beautiful question. Thank you for asking that. Nahirapan po talaga ako for such a simple question. From Lilybeth, how true po that having the second wave of COVID now? Thank you, Doktora. Ma'am, at this point po, sobrang dami na hong nangyari. Baka tidal wave na ho eh. Tidal wave na talaga. I don't know na when it's the first wave, the second wave, or the third wave. All I know is it's just continuing to wave. Hindi na ho, ako, I can't even begin to, there are some epidemiologists like Dr. Edsel and others who say ito po yung first wave, second wave. Ako po, bilang simple lang pong doktor, my question is, again, I always tend to go through this. Does it matter po kung anong wave? Intellectual question, it's fun to talk about po talaga. I agree. But as an advisor doctor po, I would just tell you lang talaga, for all the waves po, wear a mask. Pero, now that you mentioned second wave, maiba lang ho ng konti. There is now a second wave of depression, Reina. And I'm going to talk about that next week. If the first wave of depression, sorry ito po yung, kasi I truly believe po there are two pandemics eh. Yung pandemic po ng COVID and the mental health pandemic. The first wave, and I will go into this later, was yung panic po natin nung beginning. Then that caused depression, anxiety, na out of work. Alam mo, feeling ko rin, I'm sorry to add this, feeling ko this second wave of depression is much more serious. Kasi in the beginning, we had hope. Ngayon, parang wala na eh, parang hopeless. And I really think that this second wave of depression, for the continuing tidal wave of COVID, is going to be mabigat, Reina. Mabigat.
I acknowledge that, Doktora. Plus, ako, ito lang yung sa akin ha. Sana din ma-discuss natin sa platform natin ha. Because I have known several friends na nasa nursing, nasa medical industry tayo. I've known some of my friends na nagka-COVID and lahat sila na-depress. Probably, let's put one topic na
next week. It's called the second week.
Yung stress and depression ng mga may COVID. Paano nila, tulungan natin silang makakope. Ano yung pwede nilang gawin? Kasi sa totoo lang, ang next thing na naiisip nila dahil they feel like they are a burden, they blame themselves. That's
Oo
already
naman.
diba, that's already signs and symptoms of depression.
Oo,
Pity
wag
party.
naman, guys. You know, nobody chose to have COVID.
Yeah,
Please.
let's
And
have them
even
go
those na
like,
hindi
oh,
nakalimot, tao lang tayo. Tao lang tayo. Please, don't think that
yeah,
way. Pero
probably,
marami guilty rin lalo na
oo, lahat
they
sila
call
halos sa mga nakausap ko.
wag po. So, ma'am,
Ah,
again, thank you for that question. What wave? Siguro the scientists can answer that. I am not really a hard scientist. So, ako po, I would answer that sa inyo po na sa akin, parang tidal wave. Okay. Pero sige, to add pa more that, sabi po ni MB Joshua, knowing po the genetic codes of the virus can help us determine kung saan po sila nanggaling. Yun. And what wave. From Miss Marilyn, what about po yung kay Doktora Karen? Ma'am, eto lang po, namayapa po yung tao, she's a doctor. I do not like to speculate po in public about somebody's illness or death. That's really, I understand that everyone is curious. Ako rin po, I am curious. But the most important po siguro is that we wait for the Philippine General Hospital po to give us po their thoughts on the matter. Ako, I wasn't involved there, so I cannot answer it. Curious din po ako. But as I said po last Monday, let's wait po for the Philippine General Hospital to come out po with their understanding and explanation po of the matter. Very sad po yung nangyari dun sa tao. Ako rin, hindi ko po rin po alam. And since I don't know po the details, I cannot give you a proper answer. So, the best answer for you is let's wait po talaga for PGH. Pero marami rin hong nagtatanong. A lot of, sige, tuldukin ko na rin po. A lot of people are asking about Secretary Anyo. Again, I am not, I don't know the details. Let's wait po for Sec Anyo to release po kung ano po ang nangyari. We have to respect din po yung privacy ng tao. And I mentioned po there are three really main issues. Baka naman ho, the lab made a mistake. That is possible. Number two, possible po na sige, let's go into this na rin, yung tinatawag po nating chronic COVID. Okay? There is a COVID po na parang nagtatagal eh. And some months after, people still don't feel well. They don't know whether this is results of the kung may chronic COVID ba. Bakit ang tagal-tagal na po, hindi pa rin. Some people are saying these are sequelae po of, what is the meaning of sequelae? Ang mga doktor talaga. Some people are saying, nararamdaman po ng mga tao months after are just po talagang, parang kasama pa rin ho nung first, Kasi ito lang when people get very seriously ill, bacterial illness po, and then they go into the ICU, natubo pa po sila. What's the meaning of natubo? Na they were breathing from a ventilator. And then after 1 month, 2 months, nabunot po. And then they go for rehab. Up to 1 year po after, and even longer, depending on their age, they can still, hindi pa po bumabalik sa normal yung puso nila, yung baga po nila, yung atay po nila. I had a very young person. Up to a year after, his echo was not normal. He actually approached me and said, Doktora, will this ever get better? So sabi ko, it can take time. So yun lang po yun eh. There can be, baka ho yung chronic is not really the second time, but it might be the bad effects pa rin ho of a very serious COVID infection. But on the other hand, there are cases po that viruses hide in the body and then come out again. One of this is shingles, chicken pox, and then shingles later on, many, 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 many years after. Kasi po, the chicken pox or the varicella virus hides in the nerves. And yung part 2 nyo po will become herpes zoster or shingles. But that is the same po. There's a rare case din po ng measles. Meron pong measles complication that comes out many years after. So this could happen po talaga with COVID. Again, this is all theoretical kasi hindi pa rin ho natin alam. Okay? So as as MB Joshua said last Monday, there are going to be many new discoveries po. At maganda po silang pag-usapan para ma-further po yung knowledge natin. And again, the discoveries, as a doctor po, no, there will be discoveries two kinds eh. Those talaga that are of interest to scientists and those that are, pero pareho pa rin ang sasabihin natin, which is wear a mask. And then there will be discoveries which are going to be both interesting to scientists and to people who work in the clinics and see patients. Okay? So, sige po. From Miriam, good afternoon po, Doktora. How true is this that they are now having the second wave? Sinagot na po natin yun.
May follow-up siya.
Oo. Okay. May follow-up. What do we mean by second wave?
Magandang tanong.
Ito pagkaintindi ko sa second wave, Mama. Yung may distinct, the first wave, hindi po, ang po noon, ako, the way I understand it po, first wave, dapat mawala talaga. And then, magkakaroon, talagang may distinct na mawawala. And then, darating uli, and that is the second wave. Now that you're talking about it, Reyna, kailangan mawala. Nabanggit ni Mama, I was thinking about it. Napaisip tuloy ako kasi I just said there's a second wave of depression and anxiety. Ang tanong ko, nawala ba yung depression and anxiety ng first wave?
Or baka nag-level up lang, no, Doktora?
Na-level up na lang. Tama yun, Ma'am. Tuloy, dahil sa tanong nyo, napaisip tuloy ako.
Yes.
Again, thank you for that question.
Next question po.
From Gian Serrano. WHO initially didn't advise wearing a mask. Sweden didn't require a mask. What do you say to those po, Doc? Eto po, in the beginning, I think we were all learning. And my husband always told me na I did tell him at one time daw not to wear a mask. Sabi ko, masunurin lang naman ako sa WHO, But yes, I think in the beginning there was a mistake, or maybe they did not realize po what's going on po talaga. Though I have to say, in my defense, Reyna, in my defense, I wanted to buy a mask end of January pa lang. In fact, hinahanap ko nga ho sa chief of staff ng kapatid ko yung mga mask. Alam mo yung sinabi sa akin, Reyna, Ma'am, naubos ho lahat sa Taal. And then by that time, there was an epidemic going on in Wuhan. And dun ho nang galing lahat ng mask. Naubusan po talaga ng mask sa Philippines. So in my defense, and you know this, Reyna, I've been trying to buy a mask since the end of January. In fact, nagbayad pa ho ako ng 5,000 to my bookkeeper, si Miss Hazel, and my pamangkin, who knows daw maraming importers, si Mr. Gio Sagum. And both, they returned the money to me, telling me that there's no available mask. So, hindi naman ako dun sa, I think I was trying to buy a mask talaga nung January pa lang. Okay? With regards to the WHO, I think they also did not understand or did not, nag-iiba po yung policy based on what's happening on the ground. With regards naman po sa Sweden, tama po kayo. Pero I read an article po that Sweden has actually more deaths per million than Philippines. So pag-isip, I don't think, parang nagkaroon din po ng problema sa Sweden. It was not an easy task for them. So sige, from Andrea, yun pong cases po ni Doktora Karen, was it really a case of reinfection? Ma'am, I am not one who treated Doktora Karen, so I cannot really speculate po or give any opinion. I don't know the details po eh. As I told Ma'am Marilyn, we will wait po talaga. And last Monday, sinabi ko na rin po, hintayin po natin yung statement po ng PGH at saka po ng pamilya. Okay, I really don't know anything. Opo. From Miss Joyce, may kumare, Doktora, yung patient po na nakasurvive na po ng COVID, ang dapat mas doble po ang ingat na bumabalik po itong COVID. Yes, ma'am, I agree. Kasi, not all people survive COVID well. What I mean is, yung iba may sequelae. Ano ba sequelae? Stop using medical terms. Yung iba po, may nararamdaman pa po despite most of the people go back to 95%. But there are cases po of people, lalo na po yung mga pre-existing condition, yung mga diabetic, hypertensive, asthma, may edad na po. Talagang it will take them a long time to recover. So tama po kayo, ma'am. Dapat po mas lalong mag-ingat po ang mga taong to because their immune system, well, nagkasakit na ho sila. We don't want them to get sick a second time. Opo. Baka they haven't even gotten back to where they were before, then they get sick again. So tama po yan. From Miss Elizabeth, if wearing a face mask can save you from COVID, bakit po ang daming tinatamaan ng mga frontliners? Kakalungkot naman po. Mama, I'm also so sad that doctors are being affected po sa Pilipinas. But again, and there is a study by the Philippine General Hospital po eh. And then the RITM case na ang dami pong nagkasakit sa RITM from a clerk or something like that. Marami po, no? Marami pong naging infection. Sometimes we think it came from the patients, but actually it came po from outside in the community. And then nagkahawaan po when they were eating and they took off their PPE and their masks. So actually, sometimes, narinig ko na rin ito from doctors, Harina, mas maingat pa nga sila in the COVID wards. Kasi at least, alam nila yung kaharap nila. Sometimes, while shopping, being with friends, dun sila hindi ganon kaingat. Or co-workers eating lunch, most common talaga. So yes, ma'am, I find it quite sad that frontliners did get sick, but we don't know po if the frontliners got it literally from the, siguro in the beginning, yes. Pero ngayon July po, and may nabasa rin po ako nagtanong, we're not sure really if the frontliners got it from the patients mismo. Or if they got it po from the community kasi they don't naman po live in the hospital, they also go out. So possible po na nahawa po sila from other persons. So yun po. And a lot of people have said that yun nga, it's actually safer in the COVID ward kasi talagang yung kaingat-ingat mo doon na somehow pag wala ka na sa COVID ward, eh medyo nare-relax ka. And that's when the problem occurs.
Doctora, can I just add on this?
Oh, sure.
We have to take in consideration also na yung mga frontliners natin, hindi lang naman paghinga or paglalagay ng face mask ang ginagawa nila. Sometimes, sometimes when they use the bathroom, they have to, tanggalin yung PPE nila.
It's really hard.
It's not just the mask. You have to also consider their activity. No, may it be inside the hospital or on their home or on their community. And these frontliners, mind you ha, Doktora, they have been outside since day one of this COVID pandemic. So, that's just my answer. Kaya madaming natamaan na frontliner because frontliner talaga sila. Sila talaga ang unang tatamaan. Kaya nga tinawag silang frontliner. Tama ba ako, Doktora?
Yes, naman. But Reina, we have to take into consideration that in other countries, hindi na talaga masyadong nagkakasakit ang mga frontliners from the hospital.
Yes.
Maraming nangyayari. And then of course, people naman rightly say na pagod na po sila. This is true naman. That is true naman. They are exposed. They make mistakes. Natural lang po yun. That's why, ito lang sa mga hospitals, dapat mag-rotation ng mga tao. Hindi po pwedeng isabak na lang ng isabak po yung parehong tao. There has to be a rotation. And again, number 2, people need vacation then and breaks for their mental health. For their mental health. Hindi po pwedeng isabak nila yung frontliners. It's been 6 months. Some people, kailangan change grouping muna. Okay?
Yes. Doktora, may add ko lang ulit. Since nasa frontliner tayo, mahalin natin yung mga frontliner, lalo na yung mga healthcare workers. One day, wala nang mag-aalaga sa atin.
Definitely.
Most of my colleagues na nasa field ngayon, saving people, Most of them are crying every night kasi hindi nila mahag yung mga anak nila. Ganun kahirap. Up until now with 6 months ha. And they will never know every day yung everyday paranoia daw pala doktora with COVID.
Oo, hindi pa talaga pwede.
Nakakakosta na
Hindi
daw
po
yun
a
ng
person can
PTSD.
only live a tense atmosphere for so long, Reina.
Yeah.
Ibigay ka rin.
Nakakakos daw pala ng PTSD yun. Post-traumatic stress
Yes,
disorder.
post-traumatic stress.
Yes. Imagine that for
That's
6
another
months.
topic na dapat natin i-tackle later on.
Yes. They are crying, doktora. Talagang may mga family din sila na, may alam ako, buong family na tamaan talaga, pati yung anak.
Ay,
So,
mabigat.
very, very sad.
Mabigat.
Yeah, mabigat.
Opo. Okay. From Mr. Maynardo, Doktora, sabi po ni Governor Delta na na-confused na po, confused siya kung positive, rapid, negative po pero swab, pero matagal na bago makuha yung results. Sir, I can't really understand your question, but nabanggit niyo po na matagal pong makuha yung results. Yun na lang po ang sagutin natin. For a test to be effective, it has to be dapat sensitive, napipick up niya po. Dapat specific. Yung tama po yung pinipick up. Yung pag na-pick up niya, yun ho yung COVID. And the most important rin po, dapat lumabas naman ho on time. Kasi ano pong mangyayari dun sa swab nyo kung na-swab po kayo on day 1 at lumabas po si swab ng day 14? Eh di tapos na yung quarantine nyo. So tama po kayo. I'm sorry I did not get the whole question, but you mentioned something about test delay. Tama po yun. There should at least be, sana wala na pong backlogs and test delays. Sinabi rin po ni molecular biologist Joshua, you can get the test conventional PCR in 2 days and meron po rapid PCR in within 1 day. Sana po ganun so that we can make decision on what to do. Kasi what will we do with the test kung tapos na yung quarantine? Yun. Nag-test pa tayo. From Nuki, tama po yan, doktora. Kailangan po laging naka-face mask at naka-face shield, lalo na po pag lumalabas. That is true. At pagkatapos po na magpunta sa labas, pagpasok po sa bahay, maghugas at magpalit ng damit. That's also good advice. That is good advice po. I like that po. Tama po yun. Let's
doktora, this is the
Sir
answer.
Francis, gusto ko po na mag-donate ng plasma. Sir, if you had COVID before and you would like to donate plasma, you will be tested po with, not rapid ECLIA or ELISA. Those are forms of antibody testing. And thank you for doing that because that shows po na malaki po yung puso nyo. Thank you for doing that.
Yes,
kasi every time, di ba, Reina, we keep hearing looking for for plasma recovered, ano po. If you want to do that, sir, that's a very, very good way to help another person. Thank you po. From Sherry, thank you, Doctora, for this very informative and insightful lecture. Medyo naguluhan lang po ako dahil the cloth face mask that are being sold ay 2 layers. Kailangan po ba ay 3 layers? Ma'am, okay sa akin po. Basta you cannot see, there will be no perfect mask talaga. Okay? But the most important po is that the way that you wear it. Kasi po, if you bought the most fabulous mask, like yung N95, hindi ka naman makatiis, wala po tayong pupuntahan. So yung decente lang pong mask, try not to make it a shiny fabric. Sana po 2 layers so that pwede rin naman ho sana kayong makahinga, no? Kasi wala naman rin ho mangyayari kung mahimatay kayo. But 2 layers is more than okay, ma'am. And the most important is that you use it consistently. Yun po yun. Kasi even if you have an N95 but you didn't use it because you couldn't breathe, wala na hong naitulong yun. Okay? So tama na po yun. Your face mask is doing you good. From Allen, many experts are saying po that hydroxychloroquine is effective agents to COVID, but unfortunately, it is now politicized. What is your take? My take, let's follow the science. So far, the science is not moving in that direction. Let's never follow politics. Wala ho tayong makukuhang matino doon. Lalo na po when it comes to illnesses. And that's how nagka-problema sa states kasi po na-politicize yung mask. My God, ano ba? Mask yan eh. But ganun eh. Okay? So from Mr. Maynardo, nagka-COVID at gumaling sandali. Pagkatapos, meron na po na naman siyang COVID na positive. Swab or rapid. Sir, if it's a rapid, I would not believe it. If it was a swab, again, I told you po, if to say that you got COVID twice, you need to have swab 1 and swab 2. Hindi po pwedeng isa doon rapid. And more than being swabbed, you have to be able to grow po. Kasi the fact na you have to show na it's alive. Alam mo yon? Kasi if you never grew it or cultured it in the lab, then it means it's a remnant. Opo. From Francis, in my case po kasi, na-experience ko po yung 5 of the symptoms for 2 weeks. Then, nagpa-swab test ako, negative naman. Gusto ko po kasing mag-donate ng plasma. Thank you, sir, for that. Thank you. Apo. From Serrano Giancarlo, CDC now doesn't require people exposed with other COVID patients if there are no symptoms shown and that person is healthy. This basically says that asymptomatics don't need to be tested. What do you say about this? Actually, gusto ko yun. For example, ito, isipin mo Giancarlo. Ito. And I'm talking not about the US, but about the Philippines, where we are low in resources. Okay, listen to this. Somebody gets infected. Say, yung lumalabas ng bahay nyo, Reyna. Okay? Ngayon, kayo ang close contact. You have 2 choices eh. Magpapatest ba kayo o hindi? Most people would say the close contacts should all be tested. I kind of agree with that. Okay? Kahit may nararamdaman o wala. Okay, nasa Pilipinas tayo. Walang perang magpa-test yung mga close contacts. Anong gagawin mo, Giancarlo? Ikaw, Reyna, anong gagawin mo pag walang perang magpa-test yung mga... Hindi, honestly told you, ma'am, wala ko kaming pera. It costs 5,000. 5 sila. Okay. Anong gagawin mo?
Isolate ko lang. I'll isolate
my answer, Reyna, I will quarantine them. I will quarantine them and treat them as positive. Yes. Yun, hindi sila lalabas ng bahay na yun. So even though I didn't test them, the most important is I stopped them from going out. So presume ko silang positive. Ngayon, tanungin mo sa akin, Doktora, paano yung contact tracing kung positive sila? Ganito ang gagawin ko sa mga ganon. Ipalilista ko dun sa mga 5 tao sa bahay kung saan po sila, like where do they work? Ganoon. O ano yung close contact nila? Ang gagawin ko ngayon, for example, one of them is working in an office. Itatawag ako ngayon sa office, sasabihin ko na somebody sa close contact but was not tested and decided na lang to quarantine. Pero yung sa office na yon, please, hindi naman siguro buong office, baka naman 3 lang naman. Okay? I-aware nyo lang yung 3 yon na kung may mangyari po, they need to be tested. Okay? Nag-gets mo yun, Reyna? So I was responsible enough to quarantine all these people na asymptomatic kasi wala silang perang magpa-test. So I just quarantined them. Pero when I am ready to contact trace their close contacts kung merong mangyari. Okay? So yun yung masasabi ko. I don't want to enter the fight in the US kasi wala naman ako sa Amerika. Baka sila dun mag-away. Okay, that's why I chose to come home to the Philippines after 21 days. But if I were a barangay captain or a mayor and ang COVID strategy ko, let's say, a house became positive, somebody there, and then asymptomatic naman sila, ayaw na nila magpa-test o wala na rin silang perang magpa-test, it is not wrong to quarantine them. In fact, it's even better. Quarantine na lang, ba't pa magte-test? Ngayon, i-aware mo na lang yung close contacts nila kung meron silang maging positive. Kung meron silang maging positive, let's say for example, no, si mommy, si daddy, si ate, si kuya, si lolo, lola, and baby got quarantine. Ngayon, si daddy ang positive, si mommy works in an office. Okay, ngayon, si mommy works in an office with 3 people. So yung 3 people na yun, naalamin ko sila. Ngayon, yung isa dun sa 3 yun, nag-positive. Ika-quarantine ko ngayon yung 3 yun. or not isa doon sa tatlong yon, nagkaroon ng simptomas, yun ang hahabulin ko. Okay? Did you get my point, Rins?
Yes,
It's actually not wrong not to test. What is important is that you quarantine the close contacts if they
yes.
decide not to be tested. Ang masama, yung paiikutin mo silang gano'n na walang test. Masama
Yes.
yun.
Oo. Ako naman, doktora, this is really funny. I have a frontliner here. Frontliner ang tawag ko sa kanya kasi siya yung lumalabas ng bahay namin. Yung kasambahay namin, ano. I always tell her na when you go out, treat everybody as if may COVID na silang lahat. That's what I tell her lagi. Lahat ng mga kasalubong mo.
Lang ng konti, guys.
Okay. Are you there na, doktora? Can you hear me?
Yeah, sorry, technical difficulties. Nasa Pilipinas tayo.
Yeah, I was telling my kasambahay na paglalabas ka, treat everybody as if they have COVID para umiwas ka sa kanila. Lahat ng nakikita mo, isipin mo may COVID sila. Yon. Is it funny to do that?
No, tama yun. And that's also, medyo tinutuldok din natin yung naging tanong kanina, yung, do I agree that asymptomatic should not be tested? Sa akin, knowing the limitations of the Philippines,
paano niya malalaman?
Asymptomatic close contact, kailangan bang matest? Ang sagot ko actually hindi, pero kailangan siyang ma-quarantine.
Yes, kailangan ma-quarantine. Kailangan silang lahat.
Kung ayaw niya magpa-test, kailangan tapusin niya yung 14-day quarantine.
Yes, lahat sila kailangan.
At kailangan sabihin niya sa akin kung saan siya nagtatrabaho para pag may nangyari doon, alam ko na. From Israel again, Doktora, regarding po sa high asymptomatic cases sa data established ng DOH, would this be possible na these are false positive results? Sir, kung PCR or nasal swabbing po siya, malabo po siyang false positive because the PCR, as explained po by molecular biologist Joshua, is highly sensitive po and specific. So, yun po. So, it's possible, pero I don't think it would be that big because it's a really good test. So, pag nag-positive po kayo sa PCR, malaki talaga yung possibility po talagang positive po kayo. But again, test results have been, nagka-problem. I'm not saying they're perfect. Opo. Doktora, can you post that article again? I have to send it to people. Ay, yung sa New York Times po. Sige po, nakapost po siya sa baba. From Sir Allen, sa pagkakaalam ko po ninyo, saan po nanggaling ang ginagamit na testing? Kasi po, maraming studies na yung galing sa China. Yes, unfortunately, yes. Tama po kayo. Most of the ones coming from, I am not anti-China ha, baka magalit sa akin naman Chinese government or what. But meron naman po talagang articles. No, I do not know where they came from. I'm just praying that the FDA took a good look at them. Pero I don't know lang. Okay? From Maria Villanueva, what is the second wave of COVID? Ang explanation po talaga doon, ma'am, yung second wave is supposed to be the first wave na natapos and then nag-flatten po, nawala actually, and then umakyat uli. And that is supposed to be the second wave. Pero kung wala naman hong bumababa, tidal wave nga. Yun po. From Ruel Fuentes, hindi kaya parang hybrid version ng trangkaso po yung COVID? Kasi po paulit-ulit pwedeng ulit magkaroon ng parang trangkaso. The use of the word hybrid po ang hirap pong anong meaning? Hindi ko maano eh. I'm trying to get it from a scientific point of view. I don't want to answer po kasi I'm not a molecular biologist. Baka magalit po sa akin yung mga molecular biologists to even try to use the word hybrid. Okay, ito na lang is what I picked up from your question. Ang trangkaso po pwedeng maulit because there are many po viruses that cause the flu, not only or not that cause the common cold. So it's not only one. The coronavirus is one of them. There are others. And again, it doesn't last. The immunity does not last doon. So is it possible to be similar to that itong COVID? It's possible po. It is possible. From Nuki Alfonso, Doktora, Ang tanong ko lang po, ano po ang mas maganda po na ligtas sa mga face mask, yung mga washable po or disposable mask para po maganda at eto, what is the best kind of face mask? Okay. Ito po ang sasabihin ko po, no? And based on the reality of living in the Philippines, okay? The best mask po is yung cup mask. Walang valve ha, buong cup mask lang. Yun po ay tinatawag po nating N95. It's made by 3M. It's used by doctors, nurses, and frontliners. Yun po talaga, yung kapit po talaga nun, nakaganon talaga eh. And you can do surgery po with a PPE and wearing an N95 and be safe. Kahit COVID patient pa ho yung kaharap nyo, you will be safe. Ang problema lang po talaga sa N95, yung kapit po talaga sa mukha ng tao, matindi. Marami pong umuuka dito. But, and I have heard stories about this from residents, talaga pong they sleep kahit sa call room na naka N95. Sobra pong pag-iingat po nila. And Karina, can you imagine to sleep with an N95? You're so tired. I just feel so bad for these people talaga. It's breaking my heart kasi ako po I could not, hindi ko talaga matagalan po yung N95 na matagal. Okay? So second issue po, that is really the best mask. But do I suggest that for the everyday? Hindi po. Kasi po, by insisting on the N95, baka ho, hindi nyo na lang isuot. Okay, so tayo po ay pupunta sa palengke, pupunta po to the grocery, pupunta to the drugstore, pupunta to the office. There are two masks that are very much okay. Number one po, surgical mask. Ito po yung mga disposable, yung blue and white. You can wear that po. Theoretically, it should be single use, pero ako, I'll be honest with you, I reuse my surgical mask. Kailan po dapat itapon? Pag talagang marumi na po. Number two, nabasa, nauhugan, yung mga ganun po. Hindi na po dapat gamitin, okay? Number three po, cloth mask. It is less protective po than a surgical mask. But definitely, it's much better po kesa walang mask. And again, if we require po yung mga hirap po sa buhay to buy a surgical mask, hindi po talaga mangyayari yun. So my suggestion is if you have money, you have a surgical mask, wala pong masama doon. You reuse it, you just dry it po. Ano? And then you can use it again. How often ang hirap sabihin eh, but just look at it that it's okay, okay? Do not put alcohol on your surgical mask. And then the second face mask, cloth mask, it's okay po. Just wash it, it's okay. It's okay po. I would say it's okay. It's not perfect, but it's okay. All right? Hugasan nyo lang po. From Maykot, Doktora, bakit po gumagaling yung mga positive daw sa COVID kung sinasabi na wala pong gamot sa COVID? Ma'am, or sir, this is an excellent question. Excellent question. It's our natural immunity po ng katawan natin that fights viruses. Majority of the viruses actually, and the cold virus, wala naman talagang gamot din eh. It's just to relieve the symptoms. So if your body can fight the COVID, it usually can, and that's why most of it is asymptomatic. Kasi malakas naman ho ang katawan ng tao. But there will be cases with people po na mahina po yung immunity, talaga pong, it's possible that the virus can overwhelm the body and then you get seriously ill, or meron din hong cases that masyado hong the immune system of the person sobrang lalaban talaga, and because of the super immune response po, natatamaan na po pati yung good cells ng katawan. So yes, it is possible to get better from COVID na walang gamot po, except just multivitamins, fruits, vegetables, water, and keeping yourself hydrated and safe. And positive attitude, ha? Opo. From Lilibeth, it was posted po by an authority that we are having the second wave of COVID in Eastern Visayas because of the local transmission. It is possible po. I don't want to blame anybody po who came from Metro Manila. If I were a mayor, okay, if I were a mayor, and I'm not a mayor, my husband is a mayor, and I really have walang karapatan to advise mayors because nobody ever elected me mayor. Okay, if I were an MHO na lang or a doctor, I would tell the mayor, yes, I think that's better. Wala akong karapatan to tell a mayor what to do hanggat ma-elect ako. Okay, so shut up muna. So ito na lang, since I'm a doctor, what I would advise po sa mga local is quarantine for 14 days. Kung pagdating po nila sa lugar po ninyo, ask them to register themselves and they need to be quarantined not in their house po, but in a government facility. Kung nasa pier po sila kukunin or sa bus terminal, they need to be quarantined in a government facility, including those po from abroad. Because I really trust better the quarantine. Eh, sana strict naman yung quarantine, ha? Kasi kung lumulusot din sa security guard, bakit pa tayo nag-quarantine? Okay, guys? Reyna, sorry. But talagang yun talaga yung katotohanan eh. Please, I mean, security guard, please don't let people outside of the quarantine. The best ho sa mga ganon is not to trust the rapid antibody test. The best is to quarantine for 10 to 14 days. So, yun lang po. From Maria, the problem is the COVID is not flattened po. It instead is still rising. Ma'am, I have to honestly tell you, meron at meron pa rin po talaga. Thank you for noting that. I cannot tell you na wala kasi meron. Okay, from Michi, sorry, I cannot read it.
Macrae, Doctor.
Macrae.
Macrae.
Macrae. Sorry, sir, Macrae. Doktora, nag-positive po ako sa COVID, but August 6. Pero yung second swab testing ko po is positive pa din. How true that after 14 days, wala na pong symptoms? Need ko pa rin hubang mag-third swab? Normally, Macrae, I don't like to answer personal questions kasi po hindi po ako ang doktor mo. So ganito na lang. Hindi, sabihin na natin hindi ikaw yon, okay? And this is for everyone. Kasi I don't want to give advice without having seen or examined the patient. So ganito na lang, I will change the question. Kung kayo po ay nagka-COVID, kailangan pa po ba ng second, let's say na swab kayo. First, positive. So, nag-quarantine ka rin na for 14 days. Ang tanong, kailangan pa po ba kayong maswab the second time? According to the new DOH guidelines po, you do not need a second swab if you have a mild to moderate COVID. Okay? Kung mild to moderate po yung COVID nyo, dun lang kayo sa bahay, no need to go to the hospital, nakarelax-relax lang kayo. But you were positive, after 3 days po na wala na po kayong simptomas, wala na po kayong lagnat, hindi na po kayo umiinom ng paracetamol, if naabot niyo po yon 14 days, no symptoms, no fever, no need po for a second swab and you can go back to work. That is the DOH advisory. Pero sometimes yung mga kumpanya, iba't iba kung yung mga advisories, dun ho pumapasok. But the DOH is advising po that there is no need for a second swab for mild to moderate cases of COVID. Ngayon, kung serious COVID po na ICU kayo, kayo po ay talagang may ibang sakit, which for example po, asthma, diabetes, very old, the doctor will advise you po, kailangan po kayo makita ng doktor nyo, the person who treated you in the hospital, and that person will advise you whether or not you need a second swab. But for the mild and the moderate po, hindi na po kailangan. Okay? So, wag na nating sabihin kayo yon, but that's my answer. Okay? Thank you, Macrae. I'm sorry. I don't want to speculate kasi napaka-unfair din sa'yo na ako yung magsabi. Okay? And again, consult your doctor. From Joyce, Ma'am Joyce, yes. Doktora, nasa patient na po ang pagpapabaya kung babalik uli ang COVID ng survivor at dapat mas pangalagaan lalo na yung kalusugan nila at ang bilin ng doktor. Ma'am, I agree with you. It depends on the patient. Pero I do not like to say nasa iyo yung kapabayaan. Kasi I don't like kasi sa akin of course may nangyari din po doon. May nangyari po. But I don't want to say na naging pabaya eh. I like to think, Rina, that all of us are trying our best but we are not perfect. Yun lang. So, I don't want to, sana huwag tayong kasalanan mo kasi ganyan, mahaba. Unless, of course, nakipag-inuman na walang mask ng 2, 3 araw, ay talagang magigera tayo doon, ha. Pero I like to think that most people are trying their best po talaga. Are trying their best. And sometimes talagang kakalat po talaga. Wag na lang po natin sabihin nagpabaya sila. Let's just say they just got COVID. And wag na nating alamin po kung saan sila nagkama. Well, sometimes it's good also to study it so you might learn. Pero kung talaga pong nag-ingat, sometimes talagang yun na lang po talaga yung mangyayari. But again, if you got COVID before, please, doble ingat na lang. That's what I could advise, okay? And please, walang inuman na 3 araw straight, okay, guys? Kung hindi, talagang ako mismo magsisisi sa'yo. From Maria, I like your, ano po? Hindi ko po mabasa.
I like your boldness, Doc. Politicize.
Wag no ma'am, wag ho ng politics. Sana po more of the health. Kasi talagang ang health po talaga sana isantabi po yung politics. That's what I mean. Isantabi po yung politics and let's work towards getting our country back to health and our economy back to health. But siguro po, why am I outspoken? Kasi I don't work for any hospital eh. I only work for myself. At hindi pa ho ako na-fire ng asawa ko. Okay pa ako. Okay. Okay ba, Rins? Ang daming tanong. Diyos ko, bakit? What happened ba? Miss Reyna has kids. Guys, last question na to, okay? And then, next Q&A na lang yung next questions. Okay, Miss Reyna? Doktora, paano naman po yung mga hirap huminga sa face mask at face shield? Kawawa naman po ang mga Pilipino. Parang pinagbawal sa kanila ang paghinga. Sa ibang bansa po, alam ko na yung tinutuldok mo and I'm gonna do something on this. Sa ibang bansa ay ayaw nila mag-mask. You brought up something that I wanted to discuss for a really long time. Pinag-usapan ho namin ng asawa ko to eh. Sometimes when there's too many rules, hindi na sumusunod yung mga tao. Pag-usapan po natin yun. I don't want kasi to be the person to say wag nang mag-face shield. Kasi talaga magva-viral na naman yun sa galit ng mga tao sa akin. Okay? Ito na lang ang sasabihin ko. Just go, I don't want to say this in public and especially not on social media. But I truly agree with you po. It is difficult to breathe using a face shield and a face mask. I advise po some people, paypayan po nila yung kanilang mukha. Paypayan po nila yung kanilang mukha. Pero it's something to talk about also and to think about. When there are too many rules, we're not going to follow even one. So magandang palaisipan po yan. Magandang palaisipan. Okay? So with that, we'll say good night. I'm sorry not to greet everyone. I didn't realize that so many people would ask questions, but I'm happy. We'll have another Q&A na lang. Siguro Saturday kung gusto nyo ng isa pang Q&A, Reina? So, Miss Reina has kids. Thank you sa tiyaga mo. And to everyone, a very good evening po.
Okay
Very
po,
good evening. Salamat po. Thank you.